Craig will call the April 10th meeting of the Central District Health Board to order. I've asked to have a silent roll call. It looks like we have a quorum. Did everyone get a chance to review the agenda? Without objection, we'll approve the agenda. Similarly, for the minutes from last meeting, any objection as the minutes as presented? Seeing none, consider the minutes approved. Next on our agenda is public comments. Doesn't look like public comments. Seeing none, moving on. Next up is oral view of the 2026 financial report progress.
That already up on the screen. So we have our budget to actual report through the end of March, which is 75% of the way through the fiscal year. Looking at the top half of page 1, you can see that our revenues from our fees, contracts, and other coming in at about 69% of budget, with our other funding being the primary flag there. That's keeping us at 69%. Both fees and contracts are pretty close to where we plan to be at this point in the year, at 74%, 72% respectively. And these numbers were adjusted after our budget revision. So we're seeing them closer to where they were months ago. When we add in our county payments that we've received and our interest revenue, we come in at 77% of where we expect to be through this time in the fiscal year. And that's great financial position to be in. Looking at our expenditures, we're seeing same trends we've seen so far this fiscal year, coming in under our budgeted amounts. Our personnel's coming in at about 73% of budget. Operating, since we adjusted that at the budget revision, is now at 71%. Capital's coming in at 65%. Trustee and benefits is slightly behind, and as we talked about, that's not always cyclical. It's based on when we subgrant to the other entities in the community that we work with. So it can fluctuate throughout the year. So total expenditures are coming in at 71% of budget. So right now we're seeing about a 6% gap in where our expenditures are at this point in the fiscal year and where our revenues are. It's pretty typical compared to where we've been the last couple of years. Should be bringing that gap a little bit closer as we get closer to the end of the fiscal year. A gap over 5%, we can expect to have a healthy amount of carryover going into next fiscal year. So the closer we get over the next few months, the less carryover we'd anticipate having going into next fiscal year. On to page 2, our look compared to the last couple of fiscal years, and same thing we've been seeing. Our fees, both community environmental health and in family and clinic services, are showing a healthy increase compared to the last couple of years. And again, with our adjustment that happened at the budget revision, it's closer to where we plan to be with those changes, but compared to the last 2 years, still doing very well with our fee revenue. And when Russ presents the budget for fiscal year 27, you'll see that we've increased significantly what we anticipate our fees being based on the trend that we've been seeing for both programs. Looking at our contracts, same thing there, a decrease compared to the last 2 years. Those were all planned changes, knowing that some of our contracts from the state have continued to end over the last 2 years. And if we look back even a third year, there'd be even a bigger decrease as we were still getting COVID funds that far back. So FY24 was the first big decrease. 25 stayed about the same. And then this year we saw another decrease in our contract funds. Our revenue with the adjusted amount from budget revision, revenue from fees is showing a little bit under budget But again, that's since the adjustment before we were showing an increase there from planned amounts. Looking at our expenditures, as we saw on the first page, our personnel is slightly under budget. This, of course, the different look because it looks at pay periods rather than a comparison to the whole year where we expect to be. Operating costs are coming in a little bit under. T&B costs, as we looked at on page 1, are also under our planned amounts. And then our capital outlay, since we did the budget revision, is also just under our planned amounts.
Well, yes, Mr. Chair, on the 30% under on T&B,
Yes,
is that just
it may be. With T&B, it's completely based on who we subgrant to, how much those subgrants are, and when we enter into the agreements with our partner agencies. So that's the money that we are getting from contracts or other revenue, and then we subgrant it to partners to do work for us in the community. So it isn't based on a set cycle. It can happen anytime throughout the year, and sometimes our plans to subgrant also change throughout the year. So yeah, we don't expect to see it always going evenly down or up. And then moving on to page 3, our cash balance statement, continue to see a very healthy cash balance, 12.25 million with our total cash balances at month end. Of course, most of that's in our reserve or restricted funds. Our special projects, we'll give a few updates on those, not go through the entire list of them. The first one I want to call attention to is our capital improvement office expansion plan. So we've had architects in over the last couple of months creating the drawings for us for the change that's going to occur. So that change is in the family and clinic side of the building. The last entryway into the building will be enclosed, basically turned into part of the building rather than the archway that people walk under to come into it now. And that's going to allow us to expand our community closet out there, the space that we have available for community members to come into and clothes, toys, shoes, household items that are needed, and where they access our services, get connected to resources in the community with our community health worker. Right now, it's in a very small space. It's a closet that's fairly bigger than one of these tables, and so it's just not very accessible, and it doesn't accommodate the things that we have over there. It will also give us potentially a couple more office spaces if we wanted to use it for that. So it's a great use of space that right now is just where people walk through. We have not put that out to bid yet. The only thing we've done so far is get those drawings close to being ready to go out to bid, but it hasn't happened yet. I don't expect that we'll see, other than paying for that architectural work, the balance decrease much this fiscal year. So that may be something that we're looking at carrying over into next fiscal year, but we'll be talking about that more over the next few months to see where it's at and what the board's preference is for that project. Yes.
Can you, maybe I should have known this before, but can you explain a little bit more about the community closet and what we're doing? You said shoes and
So we have one, and Beth can talk about this more too, but we have a community health worker who connects our clients and patients to services in the community. So if people are having trouble with rent, if they need help getting registered for Medicaid, anything like that, the community health worker is the person that connects them to all those services, has a full list of resources, food banks, and that kind of thing in the community. It so happens that people also donate clothes and shoes directly to us. So if community members come in while we're connecting them to other resources and have need for jackets or shoes or warm clothes, things like that, there are some available that they're welcome to browse through and take if they need them.
so it's our version of thrift. So it's free.
Free.
Yeah, free.
Mr. Chair and Laurel, are they donated second used items or new items or both?
Mostly used items. Sometimes during the school year or the start of the school year, we'll get new backpacks and things like that. And we never put out requests for it. It's just what people happen to bring in. Beth, would you like to add any more to that? It's
I think the only thing I would really add is just it's become really popular. We've gotten to a place where we're having to say we don't have room for any more donations right now because we want to make sure the space still looks nice and clean. So part of this expansion will really help that. We also have hygiene kits that have been donated, a variety of different, sometimes there's toothbrushes. So it just really depends on what the community is providing us that we're able to give families. And it's really highly used.
Good.
The next thing I wanted to draw attention to where we haven't spent nearly as much as we planned is the IT equipment support. So one of the projects that was in this category was going to be the beginnings of scanning and cataloging all of the paper documents that we have around the building and filing cabinets and getting them all digitized. With the pushback of the implementation date of Excella, our company that we're integrating Excella with, that will be our document management system, has also been pushed back. Talk about that more when we talk about the customer modernization project. But needless to say, the scanning piece has not been ready to go during this fiscal year. So that project hasn't begun, and we're not quite ready to do it. It won't be until sometime after the implementation of Excella, once we've gotten used to using OnBase as our document management system and make sure we've got it going without a hitch. So unspent balance there as well. And then the last one with the big unspent balance is our capital improvement, almost down at the bottom of the list. Continuation with the McCall facility and the Armstrong bathroom. So the bid for the Armstrong bathroom, the bathrooms in this building, closes today. We had, I know Conan talked about it last month, 12 vendors that came through our 2 walkthroughs. As of yesterday, the traffic on actually getting bids in was very slow. I'll leave it at that. So not sure that we're going to get as many as we were hoping out of the vendors that did the walkthrough for the project. So depending on what we get in from that and what they end up being, I'll be bringing that back to you, to the board next month to share what the results are. If there is a clear winner of the bid, we'll be announcing that on the 14th, so next week. That'll be announced live the same way the county does it when they're announcing bid winners. But if we don't get to that point, then we'll bring it back to the board with what to do and how we want to either kind of plan to redirect or just indefinitely put the project on hold.
Again.
Yeah, we'll see what we get. You know, today's the last day. We could get a lot of traffic today. Not sure. So that leaves us a balance of 1.3 million with our special projects. I was hoping, I know the agency was hoping to have more of that spent this far into the year, but with those big projects being slower than expected, that's where we're at 75% of the way through the year. As Conan talked about last month, we have our personnel reserve fully funded. Our operational reserve hasn't changed. We still have the 3-month cash flow balance in there. Capital reserve fund also hasn't changed, bringing our total reserve fund designation to 6.8 million, restricted funds to 3.6, and an undesignated unrestricted cash balance of 1.8 million. Summary for the budget actual.
Any questions? Good, thank you. All right. Next, Russ on the proposed budget.
Okay, thank you. So I first want to just thank our division administrators and all of our leadership team, all our managers, because after the last meeting when you provided budget guidance, they work pretty intensely to get everything put together for each of their programs. It rolls up to the division administrators. And then, of course, with Laurel and Conan, who you met at the last meeting, they're responsible for putting this budget together and making sure it balances. So it's a lot of work to get to this point. And then what I'll present to you today is for your approval. And then the next step and the final step is the budget committee. It's the chair or whoever they delegate that responsibility to. We'll meet at 10 o'clock on May 8th here. The Boise County is going to be the host, the chair, the leader of that budget committee. And after that, the decision will either be made then to support the budget as the board approved, if you approve this one. And then we're off and running for fiscal year 27, which starts on July 1. So we took your approval or authorization of increasing the county contribution by 3%, which is what we've done every year for the last 20 years, except for 2 years during the recession years, the housing recession that hit in 08, then a little bit of a lag with property tax revenues dropping pretty significantly in the subsequent years. So I'm going to go through the budget. This is the same thing I'll do for each of the boards of commissioners before May 8th. And feel free to ask any questions you have. So we do have a balanced budget. I'll just start on page 1. Our FTE count, and Laurel kind of alluded to that as she's presenting the financial statements. We have a plan, and then things change throughout the year. And sometimes between now and when the budget committee happens, we'll maybe get another grant, or between the time the budget committee approves our budget and the fiscal year starts, we could either lose funding if, for example, one of our sub-grants coming through health and welfare gets reduced or increased. So it's I think the best way to describe it is this is our plan. The one thing that would be fixed is if we get approval for 3% from the counties, we can count on that revenue coming in. That's probably the only source. Fees will come in, but they're flexible and dynamic, as Laurel presented. But the county money is kind of our solid, assured funding stream for the fiscal year. So FTEs, you can see we have had a decline. Some of that is probably the end of the COVID era, and now we've actually reduced some positions in part due to funding or reallocation of responsibilities. We're utilizing technology. One of them that I talked about at the last meeting was we lost about $173,000 in state general fund for our home visiting program. So that was obviously disappointing. It was the letter that went under mine and your signatures to all of our legislators toward the start of the legislative session. I will call out Senator Winchell. She worked super hard, did a great job with articulating what the needs were and the impact, but we weren't able to get it across the finish line. And so that's one of the reductions, and it's a pretty significant change, and it's not something that maybe will be permanent. As we figure out throughout this coming fiscal year, if we have savings and opportunities, we may refill that position if we can. But for right now, it was a significant shortfall. So the personnel budget, on the expenditure side, is a 1% increase, and I'm going to go into this in more detail as far as what that is. The operating costs, we're seeing a pretty sizable increase. Capital outlay, small numbers, percent-wise, it looks like a really big increase. And then T&B's a 21.2% increase. And so essentially our total budget request is $16,165,600. Then we see on the revenue side that 3% county contribution that I just talked about. The state appropriation decrease was primarily the position I just talked about, but then there's some other changes that have occurred that I'll talk about in a minute. Contract revenue, slight decrease. Fee revenue, pretty sizable increase, and that is based on what Laurel just shared. That's what we're projected to continue to see, increasing fee revenue coming in throughout fiscal year 27. And then other interest revenue, we're about an 8.8% increase, and reserve and restricted funding, again, a small number, and a pretty sizable decline. So overall, we're going to see 1.4% increase in expenditures and 1.4% increase in revenues. So now we get into the detail. It starts on page 2. I always find this so fascinating. I am certain you will too when you look at population estimates, for example.
Can't wait.
Yeah, exciting time of the year next to Christmas. So, so if you look at the top box, and we call it out in our agency logo colors, you got total county funding for FY27 will be $5,847,500. And then that gets distributed based on a formula that's in Idaho code that is 30% market value, 70% based on population. So you look at each of the counties and what percentages they own of market value and population. And that produces not the overall number, that's the 3% increase, but how it gets divided, which is, I don't know what color that is. What's that middle color? Teal. So in the teal column, you'll see that the overall increase is 170,300, but it's not shared proportionally. The Ada County would see, if this gets approved, the 3% overall would see a 3.4% increase. Boise County would see a decline. Elmore's almost level, and Valley County a 1.3% increase. So if you get down to page 3, you'll see why. So the top box, fiscal year 27, Ada County and market value saw a $10 billion increase, or 10.5% increase. Boise County was 2%. Elmore County pretty significant, as was Valley County at 8.73 and 7.58 respectively. Now where the numbers come in, where you say, what is the population changes, is that Boise County's population is declining, which is counter to what, essentially we see going on, and all the septic permits and new homes going in. Elmore County, I guess, and this has happened in the past. I know Betty Ann, you and I've talked about it. These are population estimates that we use from essentially the federal government. So they do the census survey every 10 years, and then in between that, it's a bit of a guess. So I don't think these exactly reflect what we're seeing happening, certainly on our end, and you all live in your communities, and you can see the growth. Ada County kind of makes sense with another 10,000 people, but it almost feels like that's a little low from again, what we see for the
Based on Coal Road in Russia.
Yeah. But it's I call it's an objective number that we use, and the same as the market values that we get from the state. And that's essentially how that 3% gets rolled into the formula. And the numbers I just shared were Ada County, number 1, are the largest contributor. And then they see the largest increase because of the growth of market value and population relative to the other counties. All right, so on to personnel cost. So the thing that we're seeing, and you can see it in that shaded box at the bottom, and I shared this at our last meeting, is our salary increase because of the reductions we were able to make in the FTE count. Our proposal is to do a 2.5% based on an achieved performer, and a 4% based on a high performer. So that's a 1.5% gap. And that the goal here is to create a merit-based performance reviews that tie into merit-based pay increases. So the biggest cost, so you have those costs, and then you have almost $100,000 in employer cost to pay for healthcare. That's a 1-year change, $100,000. So I don't know, how that's going to play out in time. I think it's a national, right? It's a national issue. We continually call out that we're spending more and more money getting, improving health outcomes, which we certainly recognize, and that'll be an ongoing challenge I think we face in Idaho and nationally and here in our district. The good thing I think that we just learned for today, actually this morning, is the Office of Group Insurance is not going to increase the premiums for our employees. So, it's not a huge cost to the cost of living with rent, cars and insurance and all that, but it is an added cost. So if that were to increase it, I call it erodes the increase we give to our staff. So I was really pleased to see that. I know all of our leaders are pleased to see that. Our staff certainly will be, because they won't be impacted directly on that line item for their own personal budget.
So no increase in employee contribution towards the insurance.
Exactly. Yeah, they won't be paying any more for their premiums. There's all different plans, high deductible plans and PPO and traditional. So you get to choose that, but those particular plan types, the premiums won't change for our staff, just for the agency. Operating cost. So that's where we're seeing a pretty significant increase, and it's been, this again is what we planned last year compared to what we ended up spending, and what we're planning to spend this coming year is where we're going to see an increase in our operating costs. And that's not like, okay, the counties have to contribute more. A lot of that revenue, just based on how our budget is structured, will come in from sub grants, possibly like when we talk about fee revenue, our operating costs to run our vehicles all over the health district, to do things like home visits or septic system inspections. When you're paying for $4.25 a gallon instead of $2.25 a gallon, that is a prime example of where our operating cost hits the bottom line, as far as we have to do this work. A lot of it's required by law or required by our sub grants. So there's, anyway, a number of factors that cause our operating costs to increase. Capital outlay, we set aside $80,000. One of the things that we're going to need to do that we didn't build into the budget is replace the roof on this building, the shingles essentially, because I think it's 1992-ish the building was built, so everything's original and it's time. It's not dire. We don't have leaks. We don't have other issues, but that's something we'll want to avoid. And depending on what our carryover amount is, that's what we're planning to bring to you in August, if we have adequate funds. What was the amount? It's to do the roof.
250.
250. Yeah. So it's $250,000.
Is it a shingle or a rubber? Just shingles.
Shingles. Yeah. We have some.
Asphalt shingles?
Yeah. Composite asphalt shingles is what we have. Yeah.
I mean, what are you looking at? Do you know?
We're
Replacement.
to just replace them with the asphalt.
I mean, are you going to look at different materials or maybe more efficient? Since 1992?
Well,
Actually, so what all the information that we have so far is, we wanted to get just a very rough estimate to know whether something we could build into the budget or should look at carryover funds for, and also what is the remaining life on it from an expert, other than just knowing how long it's been up there.
Yeah.
So we had one person walk the job and give us just a quick estimate. So that wasn't looking at comparisons of different materials. We haven't talked to multiple vendors, so it's a very rough idea. And if we decide to do that with carryover, can look at multiple options and go into it more detail at that time.
Right.
And we'll know, obviously long before the August meeting, but in July, once the fiscal year ends, how much money we have, and we're not going to cheap on the shingles and do shingles in 15 years. But I didn't think about your idea, so we could look at okay, this is how much we have, but then look at different proposals to bring to the board as part of that carryover request and see what you want to do.
There's been a lot of changes in.
There has been, yeah. Some are 50-year now, which would be good for most beyond the rest of our lives. So,
Especially with the submembranes, you can.
yeah. Yeah, we'll want it done right.
And we're solarizing.
Yeah. Yeah, there'll be lots of options. So that's why that's not in there, like big, for $1 million, we feel pretty strongly we're gonna have more than that in carryover. And that's kind of what Laurel just described about that cap, 6%, 5%, where that's our budget. It could be a fairly sizable amount. Which is good. Considering we budgeted our personnel at 97%, that's something I failed to mention. That's what we're doing this year rather than 100%. We never spend 100%. And of course, the year we choose to do that, we have almost zero turnover, but I think we're going to be fine. And that's where it is. That's where you have the salary savings. You say we're going to spend 100%, and if staff leave, which we had some pretty significant turnover, especially during the COVID years, I call it. And now I think we're in it's an awesome place to be, low turnover rate. You have the longevity, the knowledge, the lack of training, but you don't have much money at the end of the year. Okay.
Before we flip, can I bring us back to operating cost increase?
Yes.
So you pointed out fuel as an example, but what are some others? Are there any other big ticket operating cost type things that are a large portion? I mean, the fuel, it's just been the last couple of weeks really that fuel has jumped to 4.25. Are there other big tickets, insurances or other operating expenses that are making up the bulk of that?
Mr. Chair, I think it's the trend that we've been seeing that operating costs continue to go in that direction. Some of the things we've also seen are a big uptick in like our storefront where people can request harm reduction supplies and we send them out to them. I've seen some big increases in that, but in general, costs across the programs are just going up for standard operations, the supplies that we use. We're kind of unique compared to other state agencies in the supplies that we do order, things like supplies for cooking classes, things like that, it's so much more than just office supplies that we're buying to keep our agency running and our programs functioning smoothly. Every time we do an analysis of the items that we're actually purchasing, it's always surprising to me the breadth compared to other state agencies, and the cost of all of those things have gone up and continue to go up. I think at the start of FY26, we probably underestimated how much costs were going up. So the 14% increase is just on trend with what we've seen, and it'll keep us closer. We adjusted our operating costs quite a bit during the budget revision because we had underestimated. So this should bring us in line with what things have cost. IT costs also go up. We're moving to cloud-based rather than on-prem servers. The cost of maintaining those is expensive, and almost all of our IT vendors build in a 3% increase year over year for the life of our contracts with them. That's standard in the industry. So those are big costs, and accounting for those things does eat up a chunk of the budget.
So it is the totality of
Yes.
mundane increases of copy paper and all the standard stuff. There wasn't just a couple, maybe the IT or major drivers.
Yeah. And there's bigger ones, like you said, IT cost, it's significant to start. You had 3% on top of a big number. It's different than paper cost. It could increase 20%, but overall budget impact would be a lot less than your big cost drivers.
So whiteout isn't killing us.
Not yet. No.
No, we're kind of started doing like a trade your office supplies thing.
Yeah,
So that, stuff that you didn't need, like
right.
a rummage sale type of thing. Our county, it's the utilities and fuel.
Yeah.
It's a weird one county to drive through, but it seems like those are the two biggest increases. And insurance.
And we have a lot more staff on the road. I mean, you think about our home visiting program, our parents as teachers home visiting program is more than doubled in the last couple of years. Nurse Family Partnership didn't exist a couple of years ago, and that's their jobs. That's what they do. They're out on the road, so it does that to our cost.
How are the vehicles insured? Is that,
State insurance systems.
it's a state system? So is it more of a bulk type of thing, or do we get hit every vehicle?
It's distributed out to the programs that spend them the same way our fuel costs are, so, we just pay it throughout the year.
Are we mandated to use state insurance, or is there a better option?
I think because we get our vehicles on the state contracts, it's just part of the services that we provide as part of the contract with the state for. I could find out, but I don't know that we have leeway on that, but I can certainly find out.
Right. Next page.
Yes, let's go to the next page.
Okay. So the last couple of years, we've been able to purchase a number of new vehicles to replace older vehicles, age and high mile vehicles. And this year, we didn't put any money into the budget. I think we're in a pretty good position for our fleet right now. And that involved adding new vehicles too, because of the miles driven and the demand for the cars, which I just talked about, like growth of home visiting would be a good example. Trustee and benefit cost that are explained. It's money we get and we hand it out to community partners to do work on our behalf. Like a really simple example of that is we pay individuals to do vaping prevention in schools. So rather than sending our staff, it works pretty well because sometimes those are school employees, they're in their communities, there's the people they know and trust, and we would train them how to do the work, and then we pay them to do the work, and it comes out of T&B. One of the bigger changes with this is the Valley County Opioid Response Project, and the work. So we're continuing to get money for that, but we're adding more personnel time for our own staff versus providing money out to the community. We had a planning years, implementation year, and that's ongoing with some modifications being made. That's a Valley County focused grant. State appropriation. The changes there were the result of the loss of state general fund for home visiting. And then the other large amount of money we get is Millennium Fund dollars. And we have, once they allocate that money to the health districts, we're not like a state agency where it's use it or lose it. So if we don't spend it, we get to carry it over to the next year. So that'll increase our operating costs. We're not paying our power bill.
I feel some more operating costs.
Yeah, that'll be in the budget revision in February. Yeah.
Yes.
We'll increase the county contribution to 4%.
Keep the lights on.
Yeah. Yeah. So, what's fascinating, those of you who have been around for a while, once House Bill 316 passed, and those changes started to get implemented, phased in, starting in March of 2022, we used to get like $5 million from the state, and now it's such a small amount of money that got shifted over to the counties, but we still do get funding, and this money comes through the Department of Health and Welfare as pass-through funds, which I always thought were pretty secure, given the pass-through concept until this year when they decided they would remove $1 million, that they removed all home visiting state general fund. Health and Welfare did. Obviously, JFAC had to support that decision. So overall, it's a pretty small amount of money. The Millennium Fund dollars are really separate from state general fund and how that's generated. It's tobacco companies pay the state for all the harm they've done, and then we use that money to try to prevent future harm, especially for teens and young adults and pregnant women. Okay. Contract revenue, it's minimal, minimal change overall. The fee revenue, that just we're budgeting for what we're seeing in trends, both in the community environmental health side and the family clinic services side. Other revenue and interest, we're continuing to receive opioid settlement funds, which is pretty amazing. It was an 18-year plan, and these various manufacturers and pharmacies, and we really don't know. Like, we got one the other day, and it's like, okay, great, but we have no idea. We can't plan for that, like how much money we're going to have, but we're certainly spending it. One of the things we're doing for like Nurse Family Partnership as a prevention program, and then the things that Laurel talked about with naloxone and overdose reversal and all the training we're doing. So it's a really good situation to be in. It's just hard to plan. So
Are you saying we got an unexpected payment?
I would say it's we early on, they had like, okay, here's what you should expect from these companies, spread out, amortized, whatever you want to call it, over the next 18 years. A couple of those companies paid it all up front, but then I have no idea how many, I don't know how many people are involved in this, but it's like, there's companies I've never even heard of who are basically paying money to the state, and then we get our share, we, the health district. So
I'd say we expect to get it on an unexpected basis. Yeah. It's not a surprise when we get the notification, but we don't know when it's gonna go.
Yeah, or what the amounts are going to be
Right.
ultimately. Yeah.
Yeah, that we don't get like remaining balance from this company or expect the next one. It's just you're getting this much.
So don't count on it.
Yeah.
Yeah. So it's and it's restricted in how you spend it. I mean, you couldn't use it to subsidize like an immunization program. It's for prevention and treatment of opioid use disorders, and that's what we use it for, and we're responsible and accountable and have to report to the Attorney General's office how we're spending it, which we do. And but it's unique in that way. Like Millennium Fund dollars, there's a large amount of money that the state gets, and we go and we make a request. We have a clear picture of what that looks like, and then we budget accordingly, but not for opioid settlement funds.
Well, Elks referred to it or alluded to it a year ago or so, but we're probably going to be in the same scenario when it comes to COVID settlement funds.
Yeah, could be.
In all likelihood.
Now, Mr. Chair and Russ, we haven't had an update on our current status of the opioid therapy going on. That might be something to consider.
Right.
Yeah.
Yep.
Great.
Thank you. So the reserve and restricted funding tends to be what we use to essentially balance the budget. We have a fair amount of unrestricted funds, which you see in the cash balance statement every meeting that we have. We may or may not spend that money, but this year we're planning to, we have budgeted 278,000, and then you'll get updates on that with the financial reports. Then we've done our best to try to make this a font size that's readable and words instead of acronyms, although there's still a few. And this really provides the detail of every single program that this agency offers. And then over to the right side, far right hand column, you can see that's the, call it district funding, but that's the county contribution that is line item there. So that's the that's the budget. I think the big point, I could say the one that you're voting on the whole budget, but it's the 3% increase from the counties that we have the most, I guess, you all have the most control over whether you want to do the 3%, something more, something less. And it'll be subject to change the day it's approved. But it'll be close, and you, of course, will be informed as things change, just like Laurel does every single meeting. So this is an action item, and request your approval of this proposed budget to carry forward to our counties over the next couple of weeks, and then May 8th meeting for final decision.
Do any of the board members have any further questions? Want to dig into any more detail?
Chairman, I guess we sell swimming pools on there. Are we still, if there's some voluntary folks that are getting their pools inspected?
So we have not signed up any voluntary pools yet. We are anticipating that we will have a pool program and are working on the development of that, and we'll have more information to share with the board at the next meeting.
Like the words. Yes, so
I will move that we support the 3% request for the county or county appropriations for the next fiscal year.
Second.
does that motion also have to include
This whole budget,
Oh,
so we're approving that plus the overall.
Including the budget.
right. Put that in.
so quickly restate it, please?
Okay, I would move that we support a request 3% increase for county contributions and support of the 2027 budget as presented.
Second, any discussion on the motion before us? The motion is to add 3% for the counties and accept this budget as presented. No discussion? All in favor, say aye.
Aye.
Any opposed? Great, motion carries. Works. Okay, so next on the agenda, Curtis is up. Septic systems.
A riveting subject, yes, indeed. Thank you, Mr. Chair. And I don't have a presentation to show today. I would just like to have a discussion and get your input.
The slides would look.
Yeah, we'd be digging a lot of trenches and showing some backhoes for sure. So
Oil flush.
mostly today, I wanted to talk about our fee structure for the septic systems and to explain a little bit about the history behind that, what we've seen in some of the data, and get your advice and opinion on where you would like to see us go with our fee structure as we move forward. And so that's kind of the intent of my discussion today is to share that information and then get some feedback from you so I know how to plan accordingly as we move forward with our fees for the upcoming fiscal year. I think the first thing that I'd like to share is that historically the septic system has included several different components. There's the actual permitting of the septic systems that need to be dug into the ground and reviewed, inspected, and signed off on. There is a cost associated with that for our staff to drive out to locations, review the plot plans, dig test holes, monitor groundwater, all sorts of things that they do throughout the year. But also in addition to that, we have a couple other components that have been built into our sewage disposal fees and budget that I wanted to talk about. The first one is called accessory use. This is when the Central District Health is required typically by counties to review when somebody is applying for like a building permit or adding some type of structure to their property that will impact it. Our job then becomes to review the impact to their existing septic system and the impact to the sewage disposal. For example, if someone's remodeling a home or adding an addition to their home or adding bedrooms or anything like that, then we typically will review those as an accessory use permit to ensure that the septic system that is already permitted and in the ground is adequate to contain the additional volume of effluent that's being sent through the system. And then to permit additional drain fields as necessary, depending upon the size of stuff. So we oftentimes get requests for like, hey, we're going to build a shop on our property. And so we'll have to look at, is there going to be plumbing to the shop? Is there going to be a septic system? Is it going to hook into an existing septic system? Or we want to put an RV pad that's going to dump into our existing septic system. We'll review all of that. That has also been pulled into the sewage disposal system. And one of the things that Brent and I, the manager for the lands program, have been looking at moving into our next fiscal year is we would like to separate out that accessory use cost and develop it as its own standalone budget item, because right now that's really being brought into the sewage disposal system and it's influencing the way that we structure our current septic system permit fees, and isn't necessarily tied directly to it all the time. And so what we would like to do is one step would be to remove that from the sewage disposal line item in the budget and set that up as its own thing.
But basically new builds and modifications of existing.
For example, that could be one example, yes. That will help us have a much more clear picture of exactly what our septic permit costs actually are versus just the reviews of the plot plans and reviews of when people want to build something that's additional to their already existing structures. The second piece of that has traditionally been incorporated into the septic or the sewage disposal line item and budget and fees has been the inspection of pump trucks that are used to pump septic systems and carry the septage to sites for disposal. That has typically been incorporated into the sewage disposal fee line items as well, and something else that we would like to remove from that and pull out so that it's not influencing our fees for septic systems.
So if they're doing an addition, is there a separate smaller fee for the review as opposed to another fee for permitting or installation?
As Chair, that is correct. So for the accessory use, we do charge a different fee that is not nearly as expensive as an entire septic system permit. That fee right now is $94 for that review versus our septic system permit, which is $878. So for us to simply review the plans and sign off that, yes, this is going to be okay for the current septic system, that's basically $100 review for us. If it turns out that we're going to be issuing a permit for a septic system for a new system or a replacement system, we then move in towards that fee. If it's including test holes and we're digging test holes and evaluating and groundwater monitoring, we get into that $878 range. If it's just the review of the system and then permitting in a system without digging test holes, we're looking at a fee right around $500. So one of the things that I think will help us as we set fees moving into the next fiscal year will be as we move these two things out, the accessory use and the pumper truck fees. Pumper truck fees, we typically charge about $30 per truck to review and inspect those trucks and ensure that they're equipped properly and doing the job correctly. We'd like to separate those out and really isolate what is our cost associated with each of those so we can set fees appropriately for each of those. And then what is our cost for septic systems and set a fee that's appropriate for those. Does that make sense?
So that would be like a third program, the truck equipment.
Yeah, so right now, all three of those have been rolled into
Right.
one sewage disposal program. We'd like to line item them out into three separate things of septic systems, accessory use, and pumper trucks. That will help us get a more pinpoint and more accurate fee for each one associated with it. And based on what our workload is, our costs for our staff to do that work and that without influencing the other based on the number of septic systems. Basically, we don't want to subsidize septic system by charging pumper trucks too much or refuse for accessory use permits, subsidizing the septic systems because we're doing a lot of these reviews for accessory use
What's the interval on pumper trucks inspection?
yearly. Yeah, those are reviewed yearly. I think their licenses typically expire every year at the end of February, and on March 1st, they usually line up out here for inspections. And our staff spend quite a bit of time doing that and ensuring that they're
And
doing
what
that
do we
correctly.
charge them?
That is approximately $30 per truck.
Do they generally go out to each company's site to do the?
Yeah, they'd be able to do that as well. Some come here and bring, 4 or 5 trucks at once to get inspected. If we need to, we'll go out to sites and inspect a fleet of trucks. Some companies have one truck and we just meet them wherever and inspect the truck. But yeah, we do that routinely.
So it's that time window. So is that pretty demanding on the staff to accomplish that in that short window?
We figured it out. I mean, we know how to make it work so that we can get it done relatively quickly. And that hasn't been a problem historically for us. We usually make arrangements with the facility, well, not the facilities, the pumper truck organizations and their operators to get that done on a timely basis every year and haven't had an issue where that's a problem.
The reason I brought it up, the Bureau of Occupational Licensing would get overwhelmed on the first of the year with everybody.
Sure.
All the licenses being renewed on the same date, and they went to a birthday mechanism. So your license, your professional license came due on your birthday, so it spread that workload throughout the year.
Yeah,
Not
and
really an issue with this.
Mr. Chair, we haven't experienced an issue with that. Where I would say we have experienced an issue with that is more on our food side. Because food licenses tend to, well, in Idaho code, they all expire on December 31st. And so on January 1st, we have a renewal process that we actually kick off mid-October, where we send notice to all of the food establishments in the district, request them to update their records, pay their fee. And then when we process that, we'll issue their license for the next upcoming calendar year. There is a rush at the end of every year, November and December into mid-January to get that done. So I fully understand what you're referring to. That is in Idaho code, though, that expires. Same with the pumper trucks, that they expire on a specific date. I think as we look at our new system with Acela, one of the options that we would have would be to put that on a rolling schedule based on whatever date, their application date or whatever, assuming that Idaho code would allow us to do that. So
Yeah, that's what I was gonna ask in terms of like the following the letter of the law versus granting them the grace period while you guys have staffing to say the provisional pass until we get to you, basically.
yeah, I mean, I think we'd be open to looking at any of those methods. I think we will have a system that will support us to do that in any of those ways as well. Really, we just want to make sure that we're compliant with the law and that we're enforcing the regulations that the state of Idaho's given us. So. All right, so to the meat and potatoes of what I really want to talk about, which is our fees for these different things. One of the things that we've been looking at is, and you've seen in our budget projections that our fees, we're projecting that our fees are going to increase. And that is based on us thinking that we are going to be increasing our fees slightly in some cases and maybe more dramatically in some other cases. And so that's what I wanted to get your feedback on today is, for example, when I look at the sewage disposal program back in fiscal year 2021, was the last year where we actually broke even or ran a surplus on our budget, where our fees or revenue brought in exceeded our expenditures. From fiscal year 22 through current, we have slowly started to develop a larger deficit year over year between what our fees are producing in terms of revenue and what our expenses are creating in terms of expenditures. And expenses being primarily personnel and operating. We don't have T&B funds in this program, and we don't subcontract to anybody else to do the work for us. This is strictly paying for our staff time and for the operating cost that's associated with them traveling the district to all these various sites. As you can imagine, our personnel costs have grown over the years. Our operating costs have fluctuated a little bit. They've gone up and then dropped back down. Right now, we're currently kind of at the bottom, and I would imagine that they will trend back up as we see fuel prices and different operating costs increase over time. But one of the things we've worked really hard on is being very efficient with our operating and making sure that we're doing a great job of scheduling. For example, if we're sending someone from Boise to Valley County to do inspections, we're trying to hit as many inspections as we can in one trip so that we can reduce the number of things or transportations we have to make to various counties. That's helping reduce our operational cost. I think we've also had some changes to our operational costs based just on our staffing. We no longer have a staff member who is a full-time staff in the McCall office, and so we are serving Valley County out of Ada County, and we're sending staff on a daily basis pretty much to Valley County. We're spending a lot of drive time to do that, and that has impacts on our cost. Now, one of the great things about the sewage disposal program is that we have the ability to set fees, and in state code, it says that we can set fees that are in accordance with our expenditures to cover our costs. So what we're trying to do is get to a point where we can cover the cost and the expenditures of this program, as those costs tend to grow with personnel costs and fluctuate with our operating costs. And since fiscal year 22, we've started to see an increase in the deficit that we're starting to run. So that deficit then gets covered by the county fees that the counties then pay and has to be subsidized by that. My proposal would be that we look at adjusting our fees in a direction that would generate more revenue and help to narrow the gap between what our expenditures are and what our revenues are. My question to you all is, how aggressive would you like me to be in the planning of that gap? Now, I can share some preliminary numbers with you so you get an idea of kind of what I'm talking about, but ultimately I'd like your guidance on just how aggressive you want us to be in our planning for fees to really close this gap and start to diminish that gap. Our last fiscal year, or this current fiscal year, we had a deficit of about $500,000. And that's a large number. We went from a surplus in fiscal year 21 of about $121,000 to now running a deficit of about $500,000. That $500,000 deficit is being covered by our county funds. We do have the ability to establish our fees then to reduce that deficit so that we're not using as many county funds to do that. And we have other county funds then to distribute amongst the other programs. And like I said, right now, the most common fee that we charge right now for septic systems is the $878 fee, which includes site visits and ground monitoring as needed. And we are currently doing about 516. In the last fiscal year, we did 516 permits. One of the reasons that our revenues are down on the septic system side is we've gone from a high back in 2021 when we were running a surplus. We were doing approximately 844 septic permits a year. Several fiscal years later, we're now doing about 516 a year. Now, that is holding steady for the last 2 years, and we anticipate that maybe increasing slightly over this coming fiscal year. And that will help generate more revenue as well. But we definitely have seen a decrease in our number of permits that we've issued.
Are you finding that the deficit is coming from the new installs or the two other kind of programs in terms of time and effort?
Yeah.
Like travel time and sending people more distances, et cetera. So, you know, if you do split the budget out into three categories like that, out of those three, where you've seen the biggest loss in terms of proposed change that we're looking at right now?
Yeah, you bet, Mr. Chair. Great question. That's exactly why we wanted to split out those three things so we could see that a little bit more clear. We have seen the actual septic permits decreasing while our accessory use and pumper truck numbers tend to increase. And so in an effort to not have them necessarily influence each other so drastically or subsidize one another, that's one of the reasons why we'd like to separate them out. That way I can get an exact pulse on what my cost is for accessory use, and I can set a rate accordingly that covers our costs there. Same thing with pumper trucks and same thing with septic systems. So another piece of information that I wanted to share with the board is, as you look at the different health districts across the state, septic permits, and this is just for the installation and review and all the monitoring that goes along with that across the state, those typically range anywhere from $1,100 down to a low of $850. And so we are on the low end currently on our rate where we're at 878. We're on the low end of that. We do feel it would be appropriate to increase our rates accordingly. And we do have a policy that the board has approved previously and a mechanism on how we would do that. I think that if we followed that policy and we looked at our costs and we calculated out the number of septic permits that we'd be doing, the amount of personnel time that it's going to take to do that, and the work that we would predict would occur, we would probably see a fairly significant increase in our septic system permit application fees. And so that's my big question is, how aggressive would you like me to be in that?
Do you have a number if you do the math?
Yeah, so if I do the math, our septic systems to start to get to a point where we break even would probably need to be around $1,500 a permit. So that is a large increase, which is why I want to get your guidance on, is there a time period that you would like to see us implement that over? For example, we could implement an increase in our septic system permits on a continuous basis where, say, I'll just give some examples. Every 6 months, we increase by X percentage, or once a fiscal year for the next 3 years, we increase by X percentage, or whatever you guys would like to look at.
Mr. Chair, this is Commissioner Caldwell. I have a few questions. Well, first, I'm going to make a comment on the pumper trucks. I'm really hesitant to increase fees. Here in Valley County, we already struggle with getting people to pump their septic systems on a timely basis. And if you increase the fees to those pumper trucks, they're simply going to increase the fees down to the customer, which may actually result in less septic systems being pumped on a timely basis. So I think that's something that we need to consider there. Of the number of septic systems that you do per year, what is the percentage per counties?
Mr. Chair, a majority of those occur in Valley County and Elmore County and Boise County. And I can get you the exact numbers on that and the percentage breakdown per county on that. I don't have that with me right now, though.
Okay, and then just a follow-up question, Mr. Chair, if I may.
Yes, go ahead.
Could you explain the thought process of not having someone here in Valley County when I would assume Valley County has the highest percentage of septic system inspections?
Mr. Chair. Yeah, absolutely. Valley County has been a very difficult position for us to fill, to get somebody who is a registered environmental health specialist to be in Valley County and working out of the McCall office has proven to be quite difficult. The last time that the position was open, we advertised the position for approximately 6 weeks and had 0 qualified applicants, and we were not able to fill the position with anybody who was located in the county. The last time that the county had its own inspector that lived in Valley County and worked out of the McCall office, that individual had previously worked here in the Boise office and had taken the position in McCall and moved to Valley County, was there for a short period of time and then left the area. And at that point, the position became vacant. We worked to refill it in McCall in Valley County, and we were unsuccessful at doing that. And then in an attempt to continue to carry on the workload, we ended up refilling the position with an individual out of Ada County. And then we ended up having to cover transportation costs and all the transportation that was involved with traveling to Valley County on a nearly daily basis. Does that help, Commissioner Caldwell?
Yep. Thank you.
I think our preference would always be to fill that position with someone located in the McCall office working out of Valley County. And any opportunity we have to make that happen, I think we would jump at. It just unfortunately hasn't been the reality to be able to hire a qualified person to do that work that is also located in that county.
Do you keep that job open, so if someone happened to be qualified and was willing to move up here, you would have the opportunity to hire someone?
I think that if somebody, currently that job is not open, it is occupied by an individual. But in the event that we found someone who was willing to both live in Valley County and occupy that position, we would figure out what we could do to make that happen. I think we'd be very interested in trying to have somebody local in Valley County doing those permits so that we could reduce our operational costs dramatically, yes.
And Commissioner Caldwell, this is Russ, I see kind of where you're going with it. The problem is once the position is filled, if we were to left it open and we find somebody, what do you do with that individual that, was assigned to that area? I think our best opportunity is when the position becomes vacant. We're just talking about some different potential options. Obviously, to do this kind of work, they have to have specialized training, a related degree. And the most recent thought that we've had is find somebody who is qualified by education and then focus on the job training rather than trying to find somebody who's basically ready to fill that role right out of the gate. And but it's the bottom line is we have somebody going up there, and as everyone knows, if you've ever driven to McCall, it's in a good day it's a 2.5-hour drive. So you're talking 5 hours round trip. We have them working 10-hour days. So we have a half-time position working and a half-time position driving. Same person. So that really, that impacts our fees. Also, the things that Curtis is talking about, and then just simply from moving from the position into why our cost has gone up. We haven't been increasing our fees at the rate that kept pace with added cost. And you have added cost when you're doing 500 systems instead of 800 systems. You're doing 300 systems fewer. So when you go to Pine, if there's one septic system to look at, we're not going to make them wait for 8 weeks or 3 months to go out and because they want to go. And if we're not there to support them, you all are going to get to hear about it. So you become a lot less efficient as the number of septic systems go down. Does that make sense? The efficiencies that Curtis talked about is you can't schedule something that there's not a need for. So we become more efficient the more septic systems we're inspecting. So yeah, we're it's not ideal from kind of both those angles, but Valley County has a big demand for septic permits, and the only person we were able to have do that work is out of Boise. And for a while, our former program manager, Mike Reno, was making a trip, which was even more expensive because he was a manager level position. Same wind chill time.
Mr. Chair, this, this is a big problem. Our county has just been a massive failure between the city and the county. And personally, right now, I think this is an issue we don't want to decide quickly. I have 6 septic tanks to pump. Our system has failed in Elmore County. Currently paying an average of $900 per pump to send it to another county. A number of counties in the state are having the same issue. So
Elmore County
it's a big
Or
deal.
public
We're
services.
working on it.
Public Services agreed to take that mantle. Because it was going to the city and systems. Cannot take that in, due to whatever reason. So hopefully when that Simcoe, it's not more they have that goes down.
Yeah.
Yeah, the notices are in the paper right now, but it's, I think this is something that requires some ponderance.
Mr. Chair. Yeah, and to both Commissioner Caldwell and Commissioner Rogers' point, the cost of pumping and transporting the septic to a site that accepts it has become extremely expensive, and something that we're hoping we can bring down the cost of with this site in Elmore County, hopefully being able to accept the septic. Right now, that's typically being hauled all the way to some location in District 5, I believe in the Milner area. Jerome is where they're accepting it. And so that cost of hauling that septic and pumping has become very expensive. And we're hoping not to increase our pump truck fees dramatically, if at all. We would just like to separate them out so that we can manage them separately without having them influence the price of a septic system install as well.
So when was the last time, if we were 8 something for the permit now, when was the last time there was an increase?
So for this current fiscal year and the previous fiscal year, our fees have remained stagnant and flat. Prior to that, our fees were in the $700 range in the previous fiscal year before that. And we have not made substantial changes to our fees in several years. So it's been multiple fiscal years that we have not made dramatic or major changes to our fees.
Which then makes this shortcoming pretty dramatic. So do you have further input, or are we trying to sort out a game plan at this point?
As Chair, I'm happy to answer questions, but would turn it to you guys to provide some input. And again, I'm just looking for an idea from the board on what direction would you like to go? We would like to increase our fees to help reduce the deficit. I'd like to get some idea and feel from you all on how aggressive you'd like us to be in our planning for that.
Mr. Chair, if I could, nobody likes raising fees, but it's necessary. Raising these fees and the way you're trying to do it directly impacts the people that are installing the new systems or adding a new, whatever, tiny house or shop. So, I mean, it's not necessarily a fee for me currently, because I'm not expanding anything, but it does help growth pay for itself and not having, Boise residents that aren't using subsidized Boise County is using, or Valley County or Elmore County. I don't know how aggressive to get, because people are going to be upset about raising for the septic. I think maybe a 1 year, several year increase would probably be most palatable to Boise County residents. That's my opinion.
Mr. Chair. I think in our preliminary planning, that was where we landed as well. If we were to look at what would the total fee increase need to be, if we were to break that, say, over a 2-year structure and implement a part of that the first year, followed by the second half, the second year, that really starts to get us into alignment with what would bring us into a point where our fees are covering our cost. And again, we're not looking to turn a profit or build up an account or anything. We just want to cover our costs. We just want to get to a point where we're not subsidizing the septic and sewage disposal system program with county fees. So.
And I think that Clay brings up a good point that we just went through the budget process and Ada County gives quite a big chunk of money. If we're offsetting septic with county funds, that's not real fair to Ada County. And I don't think I'd ever say that any other. Sorry, Ada County, I heard that. I told my other two commissioners. But I also, with the legislation coming out with the ADUs and allowing more of those units, you know, taking those restrictions off of local governments and kind of state forcing their hand on, hey, you've got to get more housing for people. I like the idea of separating it so that the pumping prices don't increase because it's already bad enough with the actual permitting. But it has to be a 2 or 3 year, in my opinion.
Okay.
I mean, that's where I come from. And I don't want the pumping to offset permitting and increase that. You know, I think separating the 3 helps with accessory dwelling. And I think that's a great plan, but I think that's a steep number to climb in 1 year.
I appreciate the 2 commissioners pointing that out because I've been sitting here for the last 15 minutes trying to
Never do
figure out how to point that out from the Ada County perspective. But I think the line item separation is perfectly reasonable. That's just an internal accounting juggling, right?
That is correct, Mr. Chair.
And then I think that some phasing in, but as we phase in over a couple of years, are we phasing in at a rate that we're just not getting farther in the hole? Because 2 years from now, the costs are probably going to be more than they are now.
Mr. Chair, you're correct. And yes, we would need to both increase our rate to catch up and keep up. And so I think we would look at doing that over a couple of years. I think the approach that I would take is I would look at what we need to set our fees at to, if we were to say, get ourselves to 100% even. And then I would maybe cut that in half this first year and raise to that point. And then year 2, we could do the same exercise, look at what we need to go from here to get even. And then hopefully that's pretty close to half again, plus a little bit more maybe to keep up. And so we would have to maybe do that over a 2 to 3 year approach to get us to the point where we've caught up and then are staying current.
Sure, I concur. I like the internal trifurcation of the budgeting. I also have several septics on a farm property, and so I'm conscientious also of the cost to the consumer that would get passed on by the permitting fees of the inspection. So I think if we raise inspection prices, that should be nominal, because otherwise the consumer will pay that run. But I also agree that if one's looking at a big increase, I think it's over a couple of years time. So I think what you presented is a logical approach to bring this back to order.
Okay.
So Curtis, again, how many years are you projecting to be the optimal
Mr. Chair,
to phase in?
we've looked at 2 years as being the approach. If 2 years seems to be too steep of an increase, I think 3 years would be very appropriate.
That
But
would,
you
yeah.
have 3 years. So
Okay.
that way
3
you have
years.
it anticipated in mind. And also, so on the additions on houses versus the new septic, it's pretty big differential. But if you looked at that addition and, didn't increase on, say, that additional, that 880 whatever versus what was it, 100 something?
Yeah, it's about $94 for an accessory use
Yeah,
dwelling.
so increasing that accessory one might be a quick area to do that in terms of,
Mr. Chair.
$200 instead of $100, because it's still pretty nominal comparatively.
Precisely the reason we want to trifecate that out and line item each one of those out so that we can adjust fees for each one independently without influencing the others. Traditionally, they had all been lumped together and were dependent upon each other to influence what the prices were.
Believe it or not, I do have a septic tank also. Employed.
Majority of septic tanks, I don't think.
Then this is just informal guidance. It's not an action item.
So, Mr. Chair, I will take that information back, and as we work to calculate our fees that will be presented in the May meeting, I will have a plan that we'll present to you on what the increase will be and then what the long term over 3 years looks like so that everybody can be on the same page for that.
Right, thank you. Are we done with septics? Thank you, Curtis. Next up. Okay. Recess. 9 minutes.
Thank
Come
you.
back at 5 after.
Speaking of septic.
All right, we're good. All right, we're back from a brief recess. Next on the agenda is oral again. And we're gonna talk about modernizing the experience.
Fair. Get to talk to you about the budget all the time, but I don't always get to talk to you about the other work that support services is doing internally for the agency and then externally for our customers. So I invited Lisa Cardona here to join us today. She's the business operations specialist who oversees our customer service teams in all three of the offices. So she's directly involved in all of the projects that I'm going to talk about today and make sure our customer service teams stay up to date, have the right training, that we have a standard experience when you come into the offices. And so she's directly involved in all of that. So to start talking about the customer experience, we can go to the next slide, Justin. We're going to look at what we're doing in family and clinic services and community environmental health, and then agency-wide, how we're modernizing, what our goals are to modernize and how that aligns with our strategic plan. And support services is involved in all these efforts because we've got customer service under us and because of the IT interaction that we have with the projects that we're going to talk about. So these are, Curtis and Beth are also jointly involved in the efforts that we're going to talk about today as well. So we can move on to the next slide, which focuses on our modernizations in family and clinic services. And overall, as an agency for the last 5 years, we've been slowly and in some cases painstakingly moving towards less dependence on paper. And as we've gotten closer to that, not there all the way, not even close to all the way, but some really big efforts, we've been working to build a lot of apps internally that our staff can use to support our processes. We built a contract routing app. We're working on an app for our dental program to not have to do as much manual data entry. We built an inventory management system, a referral system. We no longer require printouts of travel plans, mileage reports, or any of those things. Those are all housed in Luma now. Just back to when I started here 5 or 6 years ago, for our inventory system, like for me to take over Bonnie's tablet that she had, my predecessor, I had to fill out a paper form, bring it to IT, put it on a stack of forms. And when we got to do inventory the next year, it was still assigned to Bonnie. We had a way to track that we kept all of our inventory, but didn't always have a very efficient way of making sure it got assigned to the right people. And it was up to Dustin to compile all those papers and make sure that they got manually data entered into the system. So we now have a system where we can scan our inventory and make sure that it's assigned to the right office and the right person. And that's all things we've done internally to help move us forward. We'd like to do that for our customers as well. So how we're doing that in family and clinic services is that through our electronic record system, our patients right now can do an online check-in, but even if they do, once they come in, they still have a series of paper forms that they have to fill out. We have some uptick of our online check-in rates, but it's minimal. It doesn't really matter if they do because they're still going to have to fill out paper forms once they get here. So what we're moving to is enhanced self-check-in, which allows us to build forms in the system so that customers can both check in online and fill out all the intake paperwork that they need to before they even get here. They can also set up payment plans and automate their payments. And what we found when they do that is an increase in our fee revenue. So that builds into what we talk about the budget all the time and how our fees are going up. And we have a goal to move 75% of our patients to that enhanced self-check-in. Probably going to take a bit of time to go there. It's kind of a lofty goal. As Russ knows, usually when we implement a big change or something new, we say 5 or 10% per year. With our enhanced self-check-in, we just went ahead and set it at a high rate of wanting to get to that 75%. We'll see how long it takes, but that is where we'd like to get to. Eventually, we'll be building screeners into the system too, so that when patients go from check-in to going back to talk to our MAs and providers, their screeners are completed online as well or digitally. But to start with, we want to at least make sure we've got all the intake forms there and that they can fill those out before they come in to the building. So you can see the features of the enhanced self-check-in and the benefits of it up on the screen. I won't read through all those, but we've covered them. And we can move on to community environmental health and talk a little bit more about Excella and what that means for us. We've been talking about it for the last 2 years, but I realized we haven't really talked much about what that actually means for the customer and how the experience is going to change for them. So you can see the description of the current state and the future state on the screen. And then in your packets, you also have the handout. It's an infographic from Excel. It looks like this. It's just their standard infographic on how turnaround times can get cut up to 50%. But on the left-hand column, you'll see the traditional process and the digital process and the comparison. And the traditional process is a pretty close description of where we are with many of our programs right now. So today, what a customer might do when they want to go through the permitting process is print out a PDF at home, fill it out, hope it's correct, physically bring it into our office, hand it in. Maybe they get feedback there or after the fact that something was missing. Then provide that, come back in to provide it, wait without visibility to where their application is in the process. They might then get a call about what the next steps are for them. They may or may not get the person's number who calls them, depending on who it is and what that person's role is. And then they have to wait till an inspection is scheduled, but they have no visibility to where their application is in the system. I personally get 1 to 2 calls a month of people just pushing buttons and hoping to get someone saying, where's my application? Then I have to transfer it over to the right person to get that answer for them because I don't have access to it. So all of that is going to change completely and in line with the digital process on the right hand of the infographic that you have. So first of all, customers will be registering for their own portal, so they'll have that 24/7 access to the system and be able to see where their application is in the process anytime that they log in. Hopefully the number of calls I get will go down, but that's to be determined. I think it's going to be the most significant change to customer service that we have had since we went to using computers at all for our inspection processes and not 100% paper. It will just be drastically different from the steps that I outlined of hoping you're printing out the right form, hoping you're filling it out correctly, and then going through a multi-step back and forth process of getting the right things to the right people with your fingers crossed that somebody will eventually get out to your property and inspect what needs to be inspected. We do have it down pretty smoothly, as Curtis has shared, and increased a lot of efficiencies, but it's often pretty blind to the customer what's happening and where they are personally in the process. So that'll be a huge change. We'll also have tablets in our front offices so that when customers come in, we can guide them through the process. And if they call in with a question on the phone, if they're trying to fill it out from home, we'll be able to guide them through where they are in the process as well. We won't right away go completely away from paper applications. We'll still have them available while we transition, but eventually the goal would be to move 100% online applications for all of our permitting and licensing programs in the environmental health side. Working with Stephanie, we also have a plan for an information campaign that will kick off this month, letting all of our customers who currently license through us that the change is coming. And then over the next few months, we'll just be providing more information. We'll be posting it on the website and informing across as many mediums as we can to let them know that a change is coming and that they'll need to register for a portal. And then in terms of staff training, we're doing that as close to go live as possible so that retention is best and they're not having to hang on to that information for a long time, continue using the old system and then go live after that. So I'll make sure that the training is very close to go live for the team that will be implementing. Yeah, so current state, future state, and like we talked about, it increases our security. It's a software as a service, so it'd be cloud-based, and we can have access to the software and make updates that we need to internally because it is open. We don't have to go back to Excel every single time we want to make a change to what the applications look like, what fields are there, or those kind of features. That's a summary of Excel, and then to go along with that, we can move to the next slide, Dustin. Right now, I've mentioned this a few times, but we still have throughout the agency, you can walk through almost any area of the staff step parts of the building and see that we have quite a lot of filing cabinets. We are moving to on-base, and that will be implemented along with Excella. And that just allows us to have a digitized and automated records management system. We want to start it out, and are starting it out with our environmental health documents to make sure that we have everything cataloged, all the historical documents moved over and accessible. And we're doing just that group of documents to start with. Once we have those moved over, we can make sure that the integration with Excella has happened seamlessly, or as seamlessly as possible. Expect there to be a few bumps along the way. There always are. Then we'll spread that out into our other divisions and groups as well. Moving into family and clinic services, into finance and purchasing, and really moving towards a digitized record management system. One of the features about OnBase that's really cool is if you scan a document, after it sees it a few times, it recognizes what type of document it is. And so if you have like the address and an invoice amount and an amount that was paid, after it sees a few documents like that, it automatically recognizes what categories all of those fields are, and you can pull it by those categories, and it files it basically where it should go. It's pretty amazing. I've seen what it looks like. And
So it's a kind of an optical scan of that. Yeah, sure.
yes, like that. And when we build those documents in, so when customers are putting in their information from building their portal, it automatically goes into the right categories. It can be pulled back up based on their accounts as well. So it's pretty cool. Exciting automation to be implementing too. We can move to the next slide, Dustin. And so a few meetings ago, we talked about our strategic plan. So I just pulled from the plan the goals that these modernizations align with most closely. Implementing Excella as our system, providing the training and support and the messaging campaign to the community. We're well on the way with all of those things with our go live date of June 15th. And then Curtis and his team will be working on developing a new plan review process, getting as efficient as we can once the system's implemented, so that maybe a year from now, the fees won't even need to go up as much as we're thinking they might now because of the gap that exists, because we're able to build some of those efficiencies in. Of course, that's a TBD, but that's one of the things we're looking at and included in the strategic plan this year. And then also streamlining our operational processes to reduce our waste and improve our efficiency, moving files from our share drive to SharePoint, utilizing that structure, and then moving paper files from Laserfish to OnBase, and updating our records retention policy to reflect that digital storage space as a retention location. So those are all things we're really excited to be moving forward on and making good progress on. Our strategic plan goes for 3 years, and these are some pretty big goals to include in it, but we're really moving quickly towards achieving them, and we'll realize them within the 3-year period of the plan, thanks to board support for that. So that's the update I wanted to give on what our customers, both internal and external, are experiencing for modernization. And nobody's filling out paper forms when they're trying to get someone's used tablet anymore. So we've moved away from that one already.
When it comes to scanning in all the legacy documents, did I hear you say you're trying to phase that in, or is there going to be like an all hands on deck project, or how labor intensive? How is that approach plan?
Mr. Chair, so some of it will just happen through us being able to attrite some of the documents. That we've had some of them long enough that when the records retention, we'll probably be able to just shred them and won't need to put them into the new system. Those that do, it will be a process that probably happens. I think 2 to 3 years is a reasonable time frame to just determine everything that can be shredded and no longer retained, and those that'll have to move over. Some of it we'll be able to do with internal staff. If there's a big push or more than what we've estimated, we can hire a contractor to do it as well. If we were going to try to do it in this fiscal year, we had planned to get a contractor to do it, knowing that now we're planning to do it over the next 2 or 3 years. It could be something that, you know, staff do part of, a contractor does part of, and or we just kind of put them in boxes and say, we'll hang on to them for the next year or two until the retention period's passed and then just shred them when that time comes.
So a lot of those are clinical documents, or majority of it's clinical. And
The clinical, environmental health documents too, for the EPI program, and for our licensing and permitting all have various retention rates. Some documents that we have need to be retained in perpetuity. So those will be digitized for sure. We may keep paper copies of some of them until, you know, we all trust the security of the system and know that they will be accessible in perpetuity as we need them to be. So, well, those, I think, questions we'll answer with Curtis and the program experts and look at what other agencies are doing to make sure we're meeting the standard for it. But yeah, it's across all the programs. And we have documents that have been around for a very, very long time.
I have a question. So I have a couple septic permits from, I don't know, 70s, 80s that are under on maps. Will I be able to find that in Central District Health? I mean, I have a paper copy right now, but
I don't know the answer to that. We have a copy, and so there's two systems now that we have. We have an old copy for documents that are that age, and then we have a more recent one that we built internally. And Curtis, I can see you have an answer to this question.
Yes, Mr. Chair.
yes, Curtis.
That's a great question. So we do have records of most installed systems back to about 1971 when they started to be required by the state and when the health districts became entities. So a lot of those systems we do have records of, not 100%, but a lot of them. Our intent is to convert them from the existing system that they're in into the new on-base system. So we'll be converting those from Laserfish to on-base and moving those documents into the new system so that you would have access to them and we'll have continued access to them as well.
I forget where I put them every time.
And then you have those that say 10 feet from this tree and the tree's been.
I have one of those. 10 feet from the back of the wall of the house, but then they put an addition on the house. And so where is this exactly?
Underneath that new bedroom.
Yeah, it's,
Yeah.
my septic lid is literally right outside the wall of the house.
Curtis.
Yeah.
Noted.
I just confess.
It's going in Excel. Forever.
Grandfather clause. All right, anything else on that? Any other questions, comments? All right. Very good, thank you. Thank you. Next up, Beth. Social drivers.
Great. Hello, thank you. So I'm just going to give a brief presentation of one of the processes that we're using in clinic, and I'll also talk a bit about our community health worker and the work she's doing that we talked a bit about earlier with the community closet. Next slide, Dustin. So first off, just starting, what are social drivers, social determinants of health? So those are the non-medical factors that influence someone's health and well-being. They cause difficulties with getting to appointments, having healthy fruits and vegetables. Can they afford that type of thing? So what we are doing for all clinic patients when they come in, next slide, Dustin, is we're doing a really brief screener with them where we're finding out that information. Do they have access to transportation? Do they have social support networks to help them? Lacking food insecurity? Are their basic needs being able to be met? And these are great questions to ask a person so that we can get a sense of like, what's the whole picture of their health and how can we help support them? But it's really important that we're not just asking this question, that we're able to help provide them with a resource afterwards. So next slide, please. That is then where our community health worker comes in. So Rosie is our current community health worker. And what happens is our clinic team, once they identify an area that a person is needing assistance and they want assistance, they're able who put in a referral into one of the systems that Laurel described earlier to her. She's able then either to meet with them right there in the lobby when they get done with their appointment, or call them afterwards to provide them with resources. Sometimes that looks like helping them to apply for Medicaid or SNAP assistance, looking at different transportation, energy bill assistance, a variety of things. The other thing she can serve as is kind of a gatekeeper. Some people will access resources from a variety of agencies, and we want to make sure that we're getting folks the right resources that they need and not kind of going from place to place looking for food assistance. So that's another piece that she's doing, is kind of serving that gatekeeper role. With that extension of the building that we're going to be having and that enclosure for the community closet, it's also going to give her a private space where she can meet with people. Right now, if you see in our lobby, she has a desk in the back, so she doesn't have that confidentiality aspect to be able to talk to people without everyone in the lobby hearing about that. So this is just one of the ways we're really trying to make sure we're taking care of the whole health of the person that we're seeing and helping to remove barriers so that they can have meet their health goals. It's worth them. So my very quick presentation, but do you have any questions?
Good, thank you. Yes, Mr. Chair. And Beth, how, now on your first question up here, it talks about housing and safe living conditions. Can you explain to me how you kind of try to coordinate those for people that don't have those?
Yeah, so Rosie has a vast knowledge of the different resources in our community, whether that's through Joshua Tree or Patch or some other places. So she can help them, or if it's applying for Section 8 housing, she can help with that. As you know, we have a housing crisis in our area, so there's not a lot of options. But she's our go-to to be able to help people navigate those systems. And then unsafe living conditions, many times that might be referring to intimate partner violence or domestic violence. So being able to connect somebody to one of the domestic violence shelters or those resources if they are ready to have those conversations.
Any other questions? Very good, thank you.
Thank you.
Director's report. Russ.
Right, thank you. First, just wanted to let you all know we're ending our celebration of National Public Health Week. So officially ends on Sunday, but today's the last work day, and we did some really fun things for our staff. And we had activities and instructor-led yoga. We had a coffee truck that had other drinks as well out in the parking lot earlier this week. Yesterday, we brought in catered lunch from Goodwood. So it's just a celebration of all of our staff. There's National Nursing Day and Dietitian Day and all kind of days, but a lot of our staff don't get recognized as those happen throughout the year. So this is our one time a year we celebrate the public health workforce. So it was, I thought it was a great success and a real, coordinated effort by several staff to make it all happen. So the schedule for the budget, Boise County will be, so you all know already, you should have it on your schedules who have the invites. So if you're a county commissioner, you'll be there. And if you're not, hopefully you'll be there. So Boise County's Tuesday, April 14th at 10 a.m. Valley County, Monday, April 20th, 11 a.m. Ada County is Wednesday, April 29th at 1:30. And then Elmore County will be Friday, May 1st at 1:30. With that, you have the county data sheets. So I think you all have those in your packets for today. And I'll be bringing copies along. I want to express my gratitude to Stephanie and her team for putting these together. Wasn't that long ago, we had maybe a couple of sheets of data and stapled together, and these are very professionally done. And a lot of graphics and numbers, and what this really tells you, it's kind of like what do we do for you? So like Commissioner Tucker, if somebody were to say, why are we giving the health district this much money, or what do they do for us? I think this is a really good tool for all of you to use Besides, it's a nice way to acknowledge and recognize the good work from your local health department. So thanks, Stephanie. The other thing I was going to share is that, I guess the other and the last thing is that the solid waste regulatory authority has changed with House Bill 555. So effective July 1st, the public health districts will be completely out of the solid waste business. You recall the conversations we had last fall. I think it was around April 20th. I sent a letter off to the Director Byrne of DEQ, saying we're no longer going to provide the regulatory oversight. It was through an MOU. We weren't required to do it. We just did it through an MOU for the non-municipal solid waste sites. And that ended up including the transfer stations, which was the discussion we had. I think the county's preference was that we continue to be involved with the transfer stations, but not the complex land application sites, things that have been implemented in recent years in Ada County. The Idaho Solid Waste Association went to the legislature and said we would want to just work with one entity, and they're planning to work with DEQ, and they're going to generate revenue through tipping fees to be able to staff up to be able to do this work that was previously done by the health districts statewide. One of the challenges, talking to Director Byrne, is those tipping fees start on July 1, which means we don't have any money yet, and they're expected to be staffed up and provide this support on a statewide basis. So there's no lag time. We, the health districts, being the 6 other district directors and talking to Jess, said, if you're interested, we'll be open to contracting with you to get paid our costs to do this work, either long-term or during the transition period. Of course, we would stay out of non-municipal solid waste if this were to come to be. So that was sort of an offer. I'm not sure how they're going to manage it and how that relationship will be ongoing, especially since most of these are county owned and operated. So nothing more, just a heads up, July 1, new change.
Question?
Sure.
Are they raising tipping fees? Maybe that's
Yeah.
something the counties are gonna have to budget, extra tipping fees
They do,
over the cost of DEQ.
Mr. Chair. The number he said, which is amazing, and they're going to generate hundreds of thousands of dollars. When I heard it, it's like, okay, it's 7 cents a ton.
7 cents a ton.
Yeah. So there's a lot of tons of trash
Yes.
around this state to generate whatever. I don't know what their budget's going to look like. Probably $300,000 or $400,000. So again, that was industry driven. That was their preference to make that change, and we certainly didn't get in their way, and that was a decision of the Idaho legislature. So there'll probably be more conversations if it doesn't work out as planned. I think our concern is public health. So if there's a need for us to get involved at some point down the road, that'll be something that will be brought back before the board. And unlike previously where we did the work with the county property tax dollars, essentially that's what covered the cost of that. We didn't charge fees. We'll expect to be paid for the work we do so that it's not passed back onto the counties again. That's all I have.
Any other questions?
I have a quick question for the director. I saw that the governor vetoed the daycare bill. Was that in line with what we were hoping for?
Mr. Chair. Yes, the daycare bill, as a lot of them are, reduce requirements, and there was issues around like fire safety, and so I guess I was surprised to see that, but I think anytime you degrade the the rules we have in place, I think it puts children at risk. So I was pleased to see that, and I don't know, Commissioner Rogers may have some thoughts on that, but every single year there's bills that seem to be taking away regulatory oversight that's in safety and health. That's always what it's all about. And sometimes bills, often they'll fail, but this year it obviously passed the legislature. So I'm sorry.
Yeah, I think a lot of times they try to deregulate something, but I honestly have to tell you, in my experience, that I think they assume the parents are gonna ask the right questions, and parents don't. I mean, they'll ask how long can my kid be here, more than they're gonna ask, what's the child provider ratio?
Yeah.
And what's your discipline policy and stuff like that. So it's very difficult, because you assume that parents are gonna do things, but sometimes that doesn't happen.
Mr. Chair. The other thing, I guess Commissioner Rogers, you're exactly right. And these are the minimum standards. These aren't like the gold standards that we're talking about that we have in Idaho. And the part that is not always factored in either is childcare is very expensive. So parents, just to be able to afford it, may be willing to make compromises that they otherwise would prefer not to do. And anything we can do to maintain the minimum standards that we have in place would be my strong preference. Good question.
Great. Anything else on that subject? All right. The last item is the new thing we added about just current event and public health. And since the last meeting, I didn't get a chance to pump out anything extra. Did any other board members see any hot media topics?
Chairman, I not necessarily media topic, but I know that in talking to our senior centers, with the flip of the pyramid and their budgeting, it's real hard to meet those federal standards. So it's a struggle they're having as far as finances and budget, because the red meats and stuff are more expensive. It's a great change, obviously. I think we can all agree, but that's something to consider when you think of your seniors. Interesting. Hard time budget wise, I think at Glenns Ferry, at least, they were able to purchase a whole beef, but then this year they're like, well, now we don't know if we can. And they're real subsidized by the farm industry in our local area. They just say, hey, come up, you can have a whole truck full of potatoes. And stuff. So we have that assistance. But I know that they've all come to the county. We have 3 in our county, with the stress of the financial aspect of food, because the guidelines changed, but the federal assistance per meal has not increased to, so that was just something, maybe not necessarily news, but kind of.
That's certainly an interesting tidbit. Of course, in the long run, with improved health or improved nutrition would come improved health and theoretically decreased healthcare costs in the long run. But yes, some of that is front-loaded cost to get to the back end health and well-being, for sure. But it's an interesting, I hadn't thought of that impact.
Our county, I don't know how other counties, we have an industrial fund for development that comes into the county, to where we encourage operations or developments to make donations in that aspect. I don't know if ever do that, but we distribute that to centers or whatever. So that helps quite a bit. It helps them. What they use that money for, it may not be the food, it could be anything. But yeah, it's definitely.
Sounds like it's driving some out of the box thinking.
And Glenns Ferry, they've started I think they call it Food Coalition or something. So they're actually freeze-drying and dehydrating when they get those amounts from those farmers, so that they have the storage But still, to buy whole beef is not always feasible in their budget.
Yes, it's a real puzzle in our country, the things we're talking about. And yet we're wasting 40% of our food.
Do it every day.
Yes.
Well, one thing I did notice was I brought an article about 2 months ago, I think, microplastics and prostate cancer. And now at NIH and Kennedy, they're finding microplastics in all kinds of tissues. And that's become apparently an emphasis of research. And we're going to be looking at that. The microplastics are so endemic in what we've done. But that's kind of shocking. 90% of prostate cancers have microplastics in the tissues.
Every tissue in your body.
Yeah, that's brain, everything.
And actually, I thank you for bringing that up last time, because I've always tried to, my personal life, but now I'm like, I'm not drinking out of it.
Yeah.
I'm doing it.
Yeah, microwaves and plastic bowls are terrible combination. Yeah.
Yes.
It'll be interesting to see if our healthcare industry, you look at take plastics out of healthcare. And our restaurant industry, they step up.
Yeah, that Costco water gets trucked in hot trucks from wherever. And, and that'll be part of the actual research if we're going to have a National Institute of Health that's willing to actually do the research and look at, the sources of those microplastics. And if it is plastic water bottles and whatnot, then what do we do to mitigate it? And Dr. Cole, did you have?
So, in my mind.
Okay. Well, does anybody have any other thoughts? Way too many. Okay, pertinent thoughts to the board. Well, if not, I think we got something done today. So with that, we're adjourned. Ooh, check that timing out.